cartilage complex, TFCC for short, okay? If you just remember TFCC, that's fine. You don't have to remember the whole thing. But what it is it's a complex of ligaments that stabilize those two joints and a little disc of cartilage that sits in it. And so people who've had trauma to the wrist, such as what I did with mine where I fell on my hand, people who've had or who are they use their hands a lot and they get into ulnar deviation position a lot, will sometimes have problems with this. So if they're people that work very specifically with their hands in certain positions or post-trauma. So for example, on me, I'm not sure that that's not where the swelling is coming from on that side because I do have pain over on that ulnar side. Having said that, it could just also be because I'm not bathing it. We'll see. Anyway, so to test it, what we do is we take the hand, it's a passive test, we take the hand, stabilizing at the wrist at the ulna, we're going to take the hand and move it into ulnar deviation. Okay, so what we're trying to do, we're trying to squish that TFCC complex, okay? And so you're just going to give a little bit of extra push at the end just to see, is that painful, okay? Now, if that's painful, then we have some sort of damage to that TFCC complex. It's getting squished in there. It's being compromised, okay? It doesn't like the pressure. And if you really want to get in, just kind of do that. That gives it a good test. Okay? Any pain with that? No. Good. Okay. The Finkelstein's test. Okay. You're going to stick your thumb. This is an active test for the patient. So you're going to put your thumb into your palm. Close your fingers around it, and then move the hand into ulnar deviation. Does that give you any pain?
No, but I can feel it stretch.
It's a stretch. For people who have a de Quervain syndrome, which is the tendons that... Try it on this hand. Okay, and tuck down.
That's it.
And you feel it?
Where did I go?
All the way, yeah. So she has inflammation of her tendons that create her snuff box, actually. Okay, so the abductor pollicis longus, extensor pollicis brevis and longus. Right, so it's one of those two tendons in there that could be a problem. So the Finkelstein's test is taking the thumb into the palm, pulling the hand down into ulnar deviation. Okay, not nice. Often they'll get the pain here. Now, if the pain is right at the snuff box, it could also indicate a fractured scaphoid, because the scaphoid sits at the base of the thumb, and technically if you're finding the scaphoid, you can find it by pushing right in the middle of the snuff box. That is the scaphoid right underneath there, right where my thumb is. And then the other side of the scaphoid is that nice bony point that you feel in the palm. Okay, so if they have a positive Finkelstein's test and they're tender in the snuff box, you may be dealing with a fractured scaphoid. But remember, a fracture is really only going to occur if there is trauma, okay? Whereas the de Quervain syndrome tends to only occur, usually anyway, with overuse types of things, okay? All right. Then, like our other joints, we can do traction and compression, all right? So traction tells us if it makes it feel worse, that there could be some ligament damage because we're stretching those ligaments. We're pulling it apart at the wrist, right? Remember I said there's all those small bones in there of the carpals. The joint is very complex. We're not going to get into very specific ligament testing between each of the carpals. We're going to do a couple general tests, okay? So traction will stretch the ligament structures, okay? It also reduces any compression on the joint. So if there's a joint problem and the traction makes it feel better, then yeah, okay, the joint is happier when the joint surfaces aren't really pushed together and touching. But if it's painful when I pull out like that, then it may indicate more like the ligament structures are being stretched. Okay, because remember the ligaments support the joint. Then you can also do compression, which is the same thing. You're just going to stabilize and push the joints together. All right, and if we're squishing the joint surfaces together and it's painful, we would expect that there's probably some joint problem there, okay? And if traction is painful, but compression isn't painful, we might go, yeah, okay, well, we were stretching the ligament structures when we were pulling on it, but we're relaxing them when we're compressing the joints, so they're no longer being stressed. Okay? All right. Now, that's more wrist stuff, okay? So if you had somebody coming in complaining of wrist stuff, you might do those ones. If you had somebody coming in complaining of a thumb thing, okay, you know what? I fell and I hurt my thumb. Okay, it's a trauma. Most likely, there's going to be some sort of injury. The valgus stress of the first metacarpal phalangeal joint. Now, we think about what we've got in the hand, okay, our first metacarpal phalangeal joint. It's not down here. That's your carpal metacarpal joint. Remember that, okay? So your metacarpal phalangeal joint, I've been talking too much this morning again. Metacarpal phalangeal joint is this one right here, okay? So it's not right at the base of the thumb, but it's technically what we think the base of the thumb. We have ligaments that are along the inside here. These ones are commonly injured on the thumb. We don't usually have them injured over here because what happens, our thumb kind of sticks out from our hand a little bit and it gets caught. Right? Okay? So we want to test those ligaments. So we're going to do a valgus stress in order to test those ligaments. So I want to make sure that I'm controlling the metacarpal bone. So I don't want it to move. All I'm going to move is the phalange. Okay, so I'm going to try and isolate that movement to this side of the joint. So I'm going to do it with it in extension. So I'm going to do this. So the only thing that's moving is my right hand. My left hand is keeping everything nice and stable. Okay, so I'm only moving one end of it. I'm going to do it in 0 degrees of flexion or extension, 0 degrees at that metacarpal phalangeal joint. Then I'm going to flex her to about 30 degrees and do it again. Okay? My bet is that somebody in this class will find some laxity. So when we do this on each other, we'll just see if anybody finds anything, just let me know. We don't want to stress it too much because it can make it sore. But Angela's got fine. She's nice and solid. I feel it's stopping there. There's no extra movement. I take her into 30 degrees. She stops there. Okay? So she's got a nice solid thumb now. Right? But this is one of the common ligaments that are injured at the thumb area. So that's why we want to know these tests. Okay, then we'll go to the fingers. And we're going to do a varus and a valgus stress at the fingers. So again, we don't have to do all of the fingers if she only comes in for this one. All right. Maybe she's coming for this one because she's been flipping the bird too much. But we'll pretend it's this one. All right. So we can stress any of these joints here by doing a varus or a valgus test, okay? So if I'm going to do a valgus test, okay, varus test, valgus test, varus test, all right? So basically side to side. Now, if we're putting them into a true anatomical position, this is a valgus test. Can you see that there? Okay. So valgus is creating the L, remember? Okay. Varus is bringing it in, bringing the distal part in towards the body. Okay. So this would be a valgus, this would be a varus. Right. And you can do that with any of the joints. Okay. Valgus, varus. So what you're trying to do is isolate it to these structures here. So I don't want to kind of rotate it and do all kinds of stuff like that. I want to just try and hold it as still as possible. There really shouldn't be a whole lot of movement there. Okay, it should be nice and stable. And I'm holding kind of tight here, aren't I? I'm squishing you a little bit. It's not too uncomfortable, hopefully, but you want to be able to stabilize that one end so that the movement's just occurring at the opposite side. Okay.
Guess you're tired now.
It's tired. I'm sorry.
No, it's okay.
Okay, we're going to go back to the wrist. I should have organized these better into wrist and then hand, but obviously I didn't. So we're going to go to carpal tunnel tests now. So the first one is called the phalanx. And Angela, what I want you to do is bring, I can't do it, but you can do it very well. Okay? So you're going to bring the dorsum of the hands together in this position. And then you're going to just make sure that she's putting a little pressure. So you're just going to hold her in there. All right? We're going to hold this position, ideally for about a minute. And so we're going to stand here and we're going to talk about the weather and so what are you doing tonight and all that kind of stuff. And what a positive would be is tingling into the area that the median nerve supplies, because what you've been doing is you're compressing the median nerve by putting the hand into this full flexion position. The median nerve, you remember, runs in through here, okay? So the median nerve supplies the palmar aspect of the thumb. This gets into your referred pain and stuff, okay? Palmar aspect of the thumb, the forefinger, the middle finger, and sometimes half of the ring finger. And it's so interesting because I can reproduce that so easily when I sleep at night and my hand must get into that flex position. I've got so much thickening in my carpal tunnel area that it's putting pressure onto my median nerve. And I woke up the first night it happened, I woke up, that's my median nerve. My finger, my middle finger, and half my ring finger. It was so wild because it was just like, that's my median nerve. It really is. I've never had to experience that before. Oh boy. So that's what you would get as a positive with this test, okay? It would either cause pain into there or numbness, tingling from here, okay? Because what we're doing is we're compromising that median nerve in the carpal tunnel area. The other way we can test the median nerve for carpal tunnel problem is to tap over it. All right, so you're going to come right at the wrist crease, okay, and you're going to come just right in the middle, and then you're just going to tap like this. And if the median nerve is really compromised, what will happen, it'll send a shower of kind of like sparks down into where that median nerve supplies. It's the weirdest feeling. Okay, so all you need to do is just tap in there. But if it's really irritated, it'll happen. Okay, you feel it? Oh yeah, okay. Not so great. All right, so those are the special tests for the wrist and hand. Okay.